Hello, everyone. This is Russell Spieth from the Ohio Program for Campus Safety and Mental Health. Jessica Zavala, but helping me out here. Um, we're very excited to have Cindy Clowner. She currently serves, and she's going to be presenting on marijuana prevention, which is a really timely, always a timely topic, basically on campuses, but in particular right now with what's happening in Ohio, a particularly relevant topic. Quickly about Ms. Clowner. She currently serves as the managing director for the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery in the College of Social Work at The Ohio State University. In this role, she oversees the day-to-day operations of the center as it works toward its mission of providing tools, training, and resources to campus professionals working to address collegiate substance misuse across the continuum. Prior to this position, she oversaw the Ohio College Initiative through Prevention Action Alliance and spent 8 years coordinating school and community-based prevention in Ohio. She obtained her Bachelor of Science in Social Work from Bowling Green State University and will graduate with her Master's in Public Health in December from OSU. She let us know she just defended yesterday, so a round of applause. And she's a licensed social worker and an Ohio Certified Prevention Specialist. Really quickly, just want to let you all know issues related to substance use, substance misuse, issues around collegiate recovery communities are things that we're increasingly hearing about interest in from our stakeholders and a need we're going to be attempting to meet going forward. So please, as always, let us know if you have ideas or topics or things you'd be interested in. So without further ado.
All right. Well, thank you, Russell. I appreciate the introduction, and I'm excited about being here with you. I'm going to be sharing my screen, and we'll go ahead and get started. So hopefully you're seeing our slide deck now. As Russell mentioned, I'm the managing director here at the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery. And we're an academic center here at Ohio State that's supporting campuses in their substance misuse prevention and collegiate recovery efforts. And so if you are a campus out there that's looking for some additional support, we have a lot of resources available to you, many of which are at no cost. And we'll actually be talking about some of the free resources that your campus can engage in with the center at the end of our session today. So we're going to be talking about marijuana and particularly around prevention on campus. And we've got a little bit of kind of groundwork and introduction that we need to do before we can jump all the way in. But our focus today is around what's new in campus prevention. And I thought a good place to start is to talk about what's new in marijuana. And the truth is there's a lot. I did a webinar around marijuana trends in 2017, and I used that slide deck as inspiration for this one. And as I was moving through it, it reminded me of just how much has changed even in that short time. So that's less than 2 years ago, and we've had additional states develop some kind of legalization around marijuana, whether that's for medical purposes or adult use. We've seen changes in the forms. We've seen a number of changes around marijuana. Lots has changed even in a short amount of time. But even when we look back to the marijuana of the 60s and 70s, it's not the same marijuana from today. The potency of marijuana has increased. The forms have evolved dramatically since the 60s and the 70s. And the culture around marijuana has changed quite a bit as well. So we've seen an increased support for the use of marijuana as medicine, as well as an increased presence in the media and increased commercialization as we've seen the involvement of dispensaries and the use of marijuana as medicine and legal use for people who are over the age of 21 in some states across the country. And all of three of these factors play a role in the issues that campuses are facing when addressing marijuana use. And so a lot is new when it comes to marijuana. Well, what's new in collegiate marijuana prevention? And unfortunately, not as much. That's the struggle that campuses have is we have campuses reach out to us all the time wanting to know, well, what should I do when it comes to marijuana prevention on campus? Is there something that I can just implement? And so we're going to talk in a little bit about how there really just aren't any interventions that can be pulled out of a box and implemented on campus that have been evaluated and have evidence that consistently shows that they're effective. And so that's a challenge that we're facing when it comes to marijuana prevention on campus. However, there are some things that we can do, and we're going to certainly address those today as well. So the focus of today, we're going to talk about the evolution of marijuana forms. We're going to discuss the changes in laws related to marijuana, specifically in Ohio. I'll share some potential prevention strategies that you can think about for your campus, and we'll also provide resources for additional information, including some of those resources that are available here at the Higher Education Center. But first, I have a question for you. And so I really like doing some polling questions, and I'm inviting you to either open a new browser window or take out your phone to participate in what will be a word cloud generation to get a better sense of the challenges that your campus is facing in regards to marijuana. So I'm using a tool called Mentimeter, which is an awesome tool if you're doing presentations with students. It's a way to engage them in your presentation. And I want you to go to the website at the top of this slide, www.menti.com. And once you pull that up, either on your phone or another browser page, it'll ask you for a code number, and that code is 531759. And so go ahead and put that code in on your phone. And then I'd like you to answer the following question. What challenges are your campuses facing in regards to marijuana? So you're welcome to put in more than one response. Each response should be on its own line, but go ahead and enter those in now, and hopefully we'll see some responses pop up in a moment. We'll give you another second. There they start to come. Okay, here they're rolling in now. And the nice thing about word clouds is we'll be able to tell if there are some consistent problems across campuses based on the size of the word. So it looks like vaping is getting pretty big. That means more than one of you have indicated that is a challenge on your campus. So you can continue to share these words. They come in on a little bit of a delay, but what I will do is I will pull this slide, the finished slide, once we have all of our responses, and I'll provide it to Russell and Jessica so that you can see what our final word cloud is. So challenges that your campus is facing: vaping, legalization, both of those are not surprising to hear. Prevention, we see challenges around academic performance, the use in residence halls, I see a couple of times on here, the impact of student success, the impact of smoke-free campuses around marijuana. So that's an interesting one we can talk about. These are great. So we're gonna, like I said, I'll provide the final slide to Jessica and Russell so that you can take a full look at it. But your responses are still going to be cataloged. We're gonna go ahead and move on. Hopefully that we can give you some tools to help start addressing some of these challenges, or at least some resources so that you can better understand your role as a campus when it comes to addressing marijuana. So I wanted to start by getting a kind of a baseline sense of the prevalence around marijuana use. And so this data is coming from the 2017 Monitoring the Future study. It's looking at college use, although this data specifically is looking at 19 to 22-year-olds is how they have kind of segregated the data. And we're looking at lifetime use, which is that teal bar, the light teal bar, annual use, which is the little bit darker bar, and 30-day use, which is the standard measure of whether a person is, if we were to ask them if they were using marijuana, we think about 30-day use as a pretty standard measure there. And so in where we were at in 2017, we're starting to see an uptick, or we've been seeing an uptick over the past 10 years since the highs that started in 1980, which was the first year of the Monitoring the Future study. And so it's still lower than in 1980, but we're certainly seeing an uptick. And to give you a sense of some of the policy changes that have been happening along the last, about 40 years. In 1996 was when we legalized marijuana for medicine in California. And in 2012 is when the first states legalized marijuana for adult use, both in Colorado and Washington, although it was about 2 more years before dispensaries actually opened up for sale, marijuana was legalized. So just to give you a sense of when the legalization movement really got its start here in the United States, and what the prevalence use was around that time. But in 2017, 30-day use was just above 20%. And then I also wanted to talk a little bit about the perception of harmfulness of marijuana. So the researchers behind Monitoring the Future study have said that the biggest predictors of drug use trends are the perception of harmfulness and disapproval ratings. And so when the perception of harm and disapproval ratings are low, we start to see increased use. And so that's what we're seeing from the Monitoring the Future study is we are continuing to see the perception of harm, the percent of people who are reporting great risk to use marijuana either once or twice, occasionally, or regularly is shifting downward. Specifically this regularly number. And then when we look at that compared to 30-day use, again, that's that same line from the previous slide of 30-day use, we're seeing that inverse impact where here perception of harmfulness is decreasing and our 30-day use is increasing. So much like what the researchers of Monitoring the Future have indicated. And before we go much further in talking about marijuana, it sometimes is a lot like alphabet soup, and I want to make sure that we all have a common language before we go any further. And so there's 400 different chemical compounds in marijuana. About 60 of those are cannabinoids, but we most often refer to two different classes of cannabinoids, THC and CBD. So THC is the psychoactive chemical in marijuana. It's the chemical that produces the high. CBD is referring to cannabidiols, and it does not cause a high. So most of about 40% of a plant's extract is CBD. And when we talk about marijuana for medicinal use, oftentimes people are referring to the use of CBD. However, even marijuana that is sold as medicine sometimes includes THC in it as well. There have been some therapeutic effects that have been found from the use of CBD, and I encourage you to take a look at a report that was released about a year ago from the National Academies of Sciences, Engineering, and Medicine. That is a really comprehensive report around the health effects of cannabis and cannabinoids. And so what the research has shown is that there is some therapeutic effects related to the use of CBD for anti-seizures, anxiety, neuroprotective factors. So there's been some studies done that it could have a benefit to those that are suffering from Parkinson's, as well as anti-tumor effects. And I encourage you to learn a little bit more about the research around the health effects of cannabis and cannabinoids. This report goes into a lot of detail around what the research is telling us in terms of what benefits might be there and what conditions marijuana, whether CBD or THC, haven't been shown to be effective in treating, because there's certainly some of those as well. So I don't know if there's any Office fans out there. I'm a fan of The Office. And so when I was thinking about this presentation, I thought about the episode, the drug testing episode, where Dwight, that's Dwight down here, he found a joint in the parking lot and of Dunder Mifflin, and started interrogating people to figure out who it was, whose joint that belonged to. And what made me laugh about this is we have Creed, who is this character here, responding to Dwight's question about, do you know what this is? And he goes into a very specific details about the strain of marijuana that's there, and Dwight responds, no, it's marijuana. And I think sometimes those of us in this space of mental health or prevention may feel this way when we're working with students who are using marijuana. Students who are using marijuana, they know their stuff, and that's important for us to remember. It's okay for us to not always know the answers, but that students know what oftentimes students who are using marijuana oftentimes know what they're talking about when it comes to the types of marijuana. There's certainly lots of different kinds of marijuana. And so when we think about plant material, it's oftentimes referred to as flower, especially now that there's lots and lots of different kinds of marijuana methods for consuming marijuana or consuming cannabis. And so when it comes to the plant material, marijuana, we can look at the THC potency and how that's changed over time. And so there's the University of Mississippi, or Ole Miss, for many years was grant funded to test the marijuana that was confiscated through law enforcement to test its THC potency. And this is data from what they have recovered and reported. You'll see that chart ends in 2013. They actually lost their funding and are no longer testing marijuana samples, but we're just a little bit over 12% THC was the average of what was being tested at Ole Miss in 2013, but it wasn't uncommon to see strains in the 20 to 25% range of THC. And in fact, in 2009, marijuana was confiscated that was 37% THC. So people are becoming more sophisticated in how they grow marijuana so that it produces a higher THC content within the plant, which of course impacts the type of high a person would have. People who are using flower or plant material might do so through joints, which are the smaller white rolls, more of a cigarette shape, or blunts that are larger or cigar size. They might use hand pipes or water bongs. Oftentimes students have a misperception that using water bongs or hookahs is healthier for you, and in part because you don't feel the heat of the smoke. The water cools the smoke, but there's no evidence that it actually removes any harmful chemicals. And so that's often a misconception that students have when it comes to using things like water bongs or hookahs. There's also THC concentrates, which we're seeing a significant uptick in the use of THC concentrates around the country. So those might be a butter or a wax-like mass that's very concentrated with their THC. They can be highly potent depending on how it is manufactured, and it can be manufactured very easily in a student's dorm room even, or it uses very sophisticated methods to get to that up to 90% THC level. And so concentrates also come in CBD form and with THC. And here's just a few different kinds of concentrates. So Keith water hash or bubble hash, rosin butane hash oils, shatter, butter. Those are some of the terms that you might hear for concentrates. And depending on the type of concentrate might determine how a person is consuming it, but vaping has become very popular. Of course, that was one of the words that got really big in our word cloud. Marijuana combusts at almost 400 degrees, and so that's when a person lights up that plant material or that flower. But vape pens or other vaporizing machines will heat marijuana up to at least 285 degrees, which is the point at which it begins to vaporize. So there's no combustion there. But people can still get high from the vapors of marijuana. And so pen vapes have become very popular. In fact, just last month, the Journal of American Medical Association did a study that showed nearly 1 in 11 U.S. students have used marijuana in electronic cigarettes. And of those who are using electronic cigarettes, 1 in 3 have used marijuana. And of course, today's high school students are tomorrow's college students. And so if this isn't an issue that you're experiencing on your campus, it is likely one that will come up in the coming years as some of these high school students begin to come onto your campuses. There's been a lot in the news about juuling. Juuling is one of the most popular electronic cigarette devices, and it comes with these cartridges that are preloaded with liquid that oftentimes has really attractive flavors to people. And you can purchase those pods. They are not produced by Juul. They're produced by other companies, but you can purchase them with oils that contain THC in them. And so here is the ad for one company from hemppod.com. So they're selling those preloaded devices that are compatible with Juuls. And then here's another one from Cushy Gold. It's pure cannabis oil pods. This one's saying it's 90% plus or more of THC. So again, really potent oils that have a lot of high concentration of THC in them that's going to really impact how a person experiences their high, that can be used in vape pens. And the challenge with vape pens, well, what makes them really challenging on campus is, of course, they're really small. Just by looking at it, you wouldn't necessarily know that someone is using marijuana in it. The odor that accompanies a vape pen dissipates really quickly. There's not nearly the same kind of odor that someone who is smoking a joint would produce. And so there's some challenges in terms of students being able to hide their vape pens or their marijuana use on campus much easier than students who were smoking plant material. People may also use concentrates by dabbing, and so that might be something that you've heard about. And here's some of the tools that people use to dab. So they use the dabber to collect the concentrate from the container, and then a person who is doing the dabbing will heat the nail, which is this rig right here, with a torch until it gets really hot. And once they put the oil on that nail, it vaporizes, and a person can inhale the vapors to be able to consume the concentrates. So that's another method that people are using to consume concentrates. Edibles have been very popular and growing in popularity over the last few years. And of course, Ohio, when it comes to our medical marijuana laws, which we'll dive into in a moment, we were really lucky because we were able to learn a lot of lessons from Colorado, for example, who had a lot of issues related to their edible use. When they legalized marijuana for adult use in particular. They had a lot of issues around accidental ingestion that led to emergency room visits, both for children, but also people ingesting too much and having an overdose from marijuana, from the cannabis that they were consuming. However, it's important to note that no one that we're aware of has ever died from a marijuana overdose, but it can cause a significant level of impairment that can lead to psychosis for some people. So we had a college student in Colorado that jumped off of a hotel balcony and died because they were under psychosis from consuming too much THC through an edible, because edibles take so much longer for people to feel the high from them. So they're ingested and then have to be digested, and so it takes a lot longer. And oftentimes, especially before in Colorado, before they implemented these emergency rules in 2014, people would have a cookie, and that cookie might include 100 milligrams of THC within it, and which would be a significant number, particularly for a novice user. And so they may consume that entire cookie, even though the standard serving size that's been set for Colorado is 10 milligrams of THC. So that's a 10 serving cookie, but it's all in one cookie. And so taking a bite of a cookie or of a gummy bear at the time that had a large quantity of THC is pretty unrealistic for some people. And so that consuming of large quantities of THC led to a lot of adverse consequences in Colorado. And so because of that, they changed their laws and how edibles are packaged and promoted. And so they use these THC squares here, the red ones, to be able to make sure that it is clear that it is not just a typical food product, that food product actually does contain THC within it. And then, of course, there's tinctures, which are marijuana-infused alcohol, and these can be put under the tongue for quick absorption, or they could be drank, which then the onset is much slower. It would resemble more of a traditional edible. So I'd like to talk a little bit about the laws, particularly around what's happening here in the state of Ohio as well. But when we look federally, marijuana continues to be a Schedule I drug, so it is an illegal substance at the federal level. However, just at the end of September, I believe, the FDA came out with a new ruling around CBD medications because of their approval of Epidiolex, which is a medication that's derived from CBD that is used to treat epilepsy, and it's been effective at doing so. And so CBD medications that contain less than 0.1% of THC and have been approved by the FDA will be considered Schedule V drugs. And it's important to note that at this point, Epidiolex is the only one at that time. And so with the Obama administration, they released the Cole memo, which said that essentially they weren't going to prosecute people who were following their state laws around marijuana, even though it was federally illegal, unless they were cultivating or trafficking marijuana. With the Trump administration, at the time, Attorney General Sessions rescinded that memo, and so that's kind of where we're at with federal policy now. However, we just had an election and a lot may be changing. And so it'll be interesting to see what happens this next year, the next couple of years, with Democrats in control of the House, with the former Attorney General Sessions no longer serving. He was a staunch opponent of marijuana legalization. President Trump has indicated that he may be in favor of legalization and adjusting some of the policies around marijuana at a federal level. So it may impact the policies that we talk about now, the laws that are in existence now, may look different in 2020. And we're seeing more and more states legalize marijuana for different purposes. So the light teal color here are states who have some kind of law on the books that is specific to CBD oil only. And so all those laws are different. For some of them, that CBD oil must be derived from the hemp plant versus the marijuana plant. And for others, those laws are more lax. The little bit darker color are states who have legalized marijuana for medicinal use. And then the dark color are the states that have legalized marijuana for adult use. And this was in January 2017. So this was an image that we put together when we launched our Cannabis Learning Collaborative. And as I started pulling things together for this presentation, I realized, wow, this slide is pretty out of date already, just a little over a year later. And as you see, I put one together that is current based on our most recent election, where Michigan legalized marijuana for adult use and Missouri and Utah both legalized for medicinal use. Our country is getting greener when it comes to the legalization and the policies and laws around marijuana. And of course, this is going to continue because we have people who are working hard to get marijuana adult use legalization on the ballot for states like New York and New Jersey. And so now that it is November, we are about 2 months behind when it comes to the implementation of our medical marijuana laws here in Ohio. We're going to go through a few slides that kind of outline some of the key things that are important for people to be aware of and for campuses to know about. As I mentioned, we had the privilege of learning some of the tough lessons that other states haven't that jumped into legalization, maybe didn't have the opportunity to learn from. And so because of that, Ohio's done a few things differently. One of the things that Ohio has done differently that's a key component to that is the Board of Pharmacy is the one who is managing a lot of the pieces around the use of marijuana as medicine in the state of Ohio. So they are the ones that are managing patient registrations, and we've also required the reporting to ORS, which is the Ohio Automated Prescription Reporting System, within 5 minutes of dispensing. So to my knowledge, we're one of the few, if not the only state that is requiring dispensaries to actually report that they're dispensing marijuana to a person in our state reporting system. So that's very interesting. Ohio has legalized marijuana for 21 conditions that have been approved. Here's a few of those. You can go to their website to see all of them. And there's the ability to apply for new conditions. So these conditions may change. We may add more of them. And that approval process just opened up, so people can start submitting petitions to be able to add additional conditions at this time to that list. But for now, there's 21 of them. Patients must register with the State Board of Pharmacy. As I've mentioned, that registration is good for 1 year. You can also be a caregiver and register on a patient's behalf as well. The marijuana cannot be homegrown. It must be grown at a licensed cultivator, processed at a licensed processing facility, and dispensed from a licensed dispensary as well. And the forms that are allowed are oils, plant material, edibles, tinctures, and patches, though it's important to note that smoking the plant material is not allowed. So you're allowed to vape, but not smoke. And the forms and the packaging cannot be attractive to children. And so this was, again, I think based on some of the lessons learned in Colorado, where they were selling gummy bears and things that looked like standard candy that a small child might be interested in. And in Colorado, they also have outlawed that. So you can't sell an edible that looks like an animal, that looks like a person. It must be, most of the edibles now are kind of just standard shapes, like a square or a circle shape. When we look at the Ohio laws by the numbers, as of November 13th, 319 physicians have been certified to be able to make recommendations. Of course, because marijuana is still illegal federally, they can't prescribe it, so they make a recommendation for medical marijuana. Most of these physicians are in private practice. A lot of large healthcare companies are not allowing their physicians that work for them to make the recommendation for medical marijuana. There's been 26 cultivators that have received approval. There's 5 testing labs, including 2 of those at universities, one at Central State University, one at Hocking Technical College. There's 14 processing licenses that have been approved, although the state can approve up to 40 processors. And there's 56 dispensaries across the country. And so here's a quick map of those. If you're living in a community that has some of those houses near it, you may want to check out and see where those dispensaries will be. The addresses are public now. And so I got this map from Leafly, Leafly.com. So I encourage you can go back and visit Leafly. It's a pro-marijuana site. But you can click on these houses then and see where those dispensaries are and get the exact location of them so that you're familiar with any dispensaries that may be in your community. When it comes to purchasing cannabis, patients or caregivers must purchase at least a day's supply at a time. And so here's how the state has defined a day's supply. So that's 1/10 of an ounce of plant material or 110 milligrams of THC in the form of an oil or an edible. You can purchase up to a 90-day supply, though. And so this is how the state has defined a 90-day supply. So no more than 8 ounces of Tier 1 medical marijuana plant material. And Tier 1 plant material is defined as having up to 23% THC within it. You can also possess no more than 5 3/10 ounces of Tier 2 medical marijuana, which is over 23%, but less than 35% THC. And you can see some of the other combinations here. You can have all of your 90-day supply can be in one form, or it can be a combination of forms, but it cannot exceed these quantities. And you can only get that 90-day supply once every 90 days. And that's part of why they are using ORS. So that's a means for tracking how often people are getting their marijuana based on their recommendations. And also the hope is to limit diversion through that as well. And so there's certainly some challenges that campuses face when it comes to marijuana use. We've already talked about how concentrates are easier to conceal through the use of vape pens because it limits the odor of them. They're also just smaller, so they're easier to conceal. Edibles, of course, are easy to conceal because it looks like normal food. So taking it out of its packaging and repackaging it would make it really challenging for people to know that that is a food product that contains marijuana in it. However, cannabis remains illegal on college campuses despite our state laws. And that is because of the Drug-Free Schools and Campuses Act. So if a campus wants to receive federal funding and financial assistance through any federal program, they must certify that they've adopted and implemented a prevention program that's designed to prevent the possession, use, and distribution of substances that have been deemed illegal at the federal level. And that is a program for both students and employees. And so there's two kind of major components when it comes to the Drug-Free Schools and Campuses Act. One is annual notification. So campuses are required to notify their students and their employees every year, as well as when they first come to campus around these things. So they need to let students know about the standards of conduct and what is expected of them, what the applicable legal sanctions are if a student were to engage in illegal substance misuse, what the health risks of alcohol misuse and drug misuse are, what are the treatment options that are available either on campus or within the community, and they must make a statement that their campus will impose disciplinary sanctions on a student who violates the standards of conduct, who possesses or uses illegal substances. They also must complete a biennial review. And biennial reviews are done every 2 years, oftentimes on the even year. So that's this year. Many of you may be busy working on wrapping up your biennial review right now to put on file in your compliance office. But the biennial review is a review of your prevention programming that's happening on your campus to determine the effectiveness and to ensure that the disciplinary sanctions that you've outlined are being consistently enforced. And so those are the two key components of the Drug-Free Schools and Campuses Act. We just had a webinar in October that dove much deeper into this. So if you are the person on your campus who is responsible for these pieces, if you have any questions about the Drug-Free Schools and Campuses Act, I encourage you to visit our website, hucaod.osu.edu, and check out that webinar. It's free. It just happened in October, and there's a number of resources that are also there that you can download and refer to that can help you with the process, particularly around the development of your biennial review. So I have another poll question for you. So if you want to open another browser window or turn on your cell phone and go back to menti.com, there's a new code this time. The code is 389300. And I'd love to know, has your campus done anything with your alcohol and drug policy in light of the increased prevalence of cannabis or the fact that it will be legal for medicinal use in Ohio? So I guess what I'm hoping to get at with this question is, have you added any kind of language around what it means for the new legal status of marijuana in Ohio to your alcohol and drug policy? So I'll give you another minute as people are voting. One of the resources I'm going to be mentioning is our Cannabis Learning Collaborative. And one of the things that we did was pull together just some sample policies of campuses who have incorporated language around marijuana, considering being it legal as a medicine on their campus. And so that, I'll let you know how you can access that, but it may serve as a resource. So it looks like we have a fairly good sized contingency of people who aren't sure about that, but the majority of people have said no. And to be honest, I'm not surprised to hear that. So of course, I think a lot of campuses say, well, it's going to be illegal on our campus anyway, so I don't know that it matters. Our drug policy is going to stay the same. And although there's certainly truth to that, there could be some benefit in revisiting our policies and making sure that students are clear on the fact that just because marijuana may be legal for medicinal purposes within the state of Ohio, it is still illegal to use on campus, because a lot of students don't always understand the difference between that, and it's caused some issues. And so as we are approaching our the last few minutes of our session so that we have some time for questions, I would definitely wanted to make sure that we talked about how campuses can address cannabis use on their campus. And the challenge I think that people have been facing, not just now, but really when legalization was becoming more of a stronghold in our country, is that we don't have, although there are certainly some programs out there that are targeting marijuana use and are billed as prevention tools, the research around them is either mixed or it's lacking altogether. And so for me to say, well, here are some evidence-based strategies to implement on your campus to prevent cannabis misuse, I just don't have a list to share with you, and that's frustrating for people. However, there is research to indicate that there are some strategies that may be beneficial, maybe evidence-informed strategies that we can implement. And because we are lacking the research to indicate that certain strategies may be evidence-based or a best practice, until we have that, it makes sense to rely on some things that we know around alcohol to help us fill the gap. And so some potential strategies, one of them is screening, brief intervention, and referral to treatment, or known as SBIRT. And SBIRT is a strategy to identify and reduce hazardous substance use. The research around SBIRT in regards to alcohol use is very substantial. It's very effective with college students. The research with other substances is a little bit more mixed, as I've mentioned, but there are studies to show that it's been effective with college students, and there's certainly benefit to screening students and making sure that we can identify students who maybe have already developed a cannabis use disorder and get them into treatment sooner. Using a screening tool like the QDIR, the Cannabis Use Disorder Identification Test Revised, is a free tool that can help you do that. So there's certainly some benefit to screening students. Another strategy for addressing cannabis use on campus is social norming. And so here's the slide that I shared earlier about the prevalence of the use of marijuana. What we know is that the perceptions of the prevalence of use are typically really out of whack when it comes to all drugs, not just marijuana, but particularly the illicit substances. Students always think that more of their peers are using than what really are. So when we look at our 30-day number, we're at about 21%. And the Monitoring the Future data doesn't actually look at perception data in terms of how many students are perceiving the frequency of their peers' use. But the American College Health Association's National College Health Assessment data does look at that. And I just want to point out that their data is very close when it comes to past 30-day use. So when you look at their fall 2017 data, their report says that 21.7% of students reported using marijuana over the last 30 days. Monitoring the Future, the number is 21.3. So very, very close numbers. And then when we look at the ACH data, in terms of perception, well, look really high, because that red dot at the very top, which is off our chart, is the perception data. So 86.1% of college students think that their peers are using, a college student thinks that 86.1% of peers are using in the last 30 days. And that's a huge discrepancy between what is perceived to be happening and what is actually happening. And there's benefit to correcting those misperceptions around use. Even we have that, it exists when it comes to daily use as well. So daily use, again, Monitoring the Future doesn't actually report on daily use, but the ACHA's assessment does. So that red dot here at the bottom, that's daily use, 2.7%, and students believe that over 10%, about 11% of students are actually consuming daily, so about 5 times the number that truly are or have reported to use daily on their own. So again, a significant discrepancy between how many students are actually using a substance and what the perceived use is. And so developing social norming campaigns that address that, requires having some campus data of your own, because we know that social norming campaigns that use your campus's data versus general data that may be collected from the NCHA for those national numbers aren't as effective. So making sure that you have data on your campus about what's happening in terms of actual use and perceived use can be helpful in adjusting the norms around use. As well as education. As I mentioned, a lot of students are not going to realize that although marijuana is legal on one side of High Street, when they cross the street and get to campus here at Ohio State, it's illegal on the other side. And so you have situations on your campus as well that are like that, where you have students who are maybe living off campus, where the use of marijuana as medicine, even if they are a registered patient to be able to use marijuana, it is still illegal to possess and use on college campuses and within their buildings and space. And so an education campaign is going to be important for your students. So if you haven't spent some time thinking about how you're going to make sure that students are aware of where the lines are in terms of the legality and the use of marijuana is for your campus, now is the time to be thinking about how you're going to do that. And so our director, Dr. Jim Lang, is from San Diego State University, and at our recent conference, he shared an immediate response information campaign that they did at SDSU. So here's an example of some content that they were using to help students understand about the differences in legality based on being on campus and being off campus that they promoted after they legalized marijuana for adult use in California. And so now is the time, really probably about a year ago was the time, but if you haven't done anything yet, now is certainly the time, because although we're behind in terms of getting the medical marijuana system operational here in Ohio, the reports are that early 2019 is when some of those cultivators will be ready for processing and testing, and we'll be starting to see dispensaries open up and selling marijuana. So we are quickly approaching the time frame where students will be able to get their recommendations and to be able to purchase marijuana to use as medicine here in Ohio. And finally, I want to remind people about environmental prevention efforts that we can do to address cannabis use on campus. So things that we can do around reducing access and enforcement are really important. So making sure people are on board on how this is being enforced on your campus, and that enforcement is consistent. And so that includes, of course, your campus safety or university law enforcement, but it also includes people like your resident advisors who have a huge role to play when it comes to the enforcement of your alcohol and drug policy on campus. So making sure that everyone is aware of what the policies are, what the expectations are of students, but also their expectations when it comes to enforcing the policies that are already in existence. And I encourage those of you, I encourage all of you actually, to reach out to community partners and see if you have a campus community or a coalition, become engaged in that. If you don't have a campus community coalition working to address substance misuse, I encourage you to ask for a seat at the table at your campus coalition and become engaged with your campus partners around this issue, because of course your students aren't living in a vacuum. Many of them may be coming to campus and living at home, living off campus. They're certainly shopping within the community and eating at restaurants and going to bars within the community and doing other things, doing things within other businesses within the community. And it's important to work closely with those partners to be able to develop a prevention strategy that works for everyone, that can have more population level impact. And so as I wrap up, I just want to let you know about some resources that are available. As I mentioned, these are all free resources through the Higher Education Center, in part because of you being an Ohio campus. And so you have, as an Ohio campus, you have free access to our Cannabis Learning Collaborative, which is a series of web-based trainings all around marijuana topics, as well as a portal that has some additional resources, including a compilation of research divided by topic, and some one-pagers around concentrates, as well as those policy references that I mentioned as well. And so just being an Ohio campus provides you free access through a partnership that we had with Prevention Action Alliance and through funding from the Ohio Department of Mental Health and Addiction Services when the Cannabis Learning Collaborative launched. And so I encourage you to take advantage of that resource. You can email us at hecaod@osu.edu so that you can get that access if you don't already have it. We have a free weekly newsletter that goes out that can give you an update on what's happening both at the center and within this prevention space in general. And we also include news briefs, news articles and research briefs within that mailing list. And so we try to keep people up to date, not just on what's happening in Ohio, of course, but what's happening across the country when it comes to the policies related to substance misuse, and of course the changing policies around marijuana are oftentimes included within that U report. And so that's one way to stay on top of what's happening in when it comes to marijuana and cannabis legalization and policies within the country. We also every week have about 3 research articles that we have a graduate student do briefs so that you can get a sense of what the latest research is and how it might apply to your work. We have a 5-part Prevention 101 webinar series that's available on our website at no cost. So if you're new to this space, or maybe you're here as a counselor, but you recognize the impact that substance misuse might be having on some of your students, and you want to learn a little bit more about alcohol and drug misuse and your role in prevention, I encourage you to take a look at that 5-part series. We also have a number of free webinars across a lot of topics. A couple of them I mentioned here. We have a webinar around specific to THC concentrates. It's on our website. One around the biennial review and being in compliance of the Drug-Free Schools and Campuses Act. And so you can check out those webinars at hecaod.osu.edu. We also have a great partner at the DEA who have put out a website, campusdrugprevention.gov, and they do podcasts and blog posts by experts and thought leaders, and it's just a really great resource source, and they're constantly putting out some new content around marijuana, but also around other substances and challenges related to prevention on college campuses when it comes to illicit substances. And so with that, I just want to encourage you to connect with us at the Higher Education Center.
Cindy, that was fantastic. Thank you so much. I thought I was hip to how people were using cannabis until I watched that. I realized that's a full-time job, just keeping up with that.
There's a lot happening, and it is constantly changing. And so one of the things that I usually mention and I didn't is the importance of using pro-marijuana resources to help kind of stay on top of things. So don't be afraid to check out some of those resources that those websites that are pro-marijuana. It gives you a good insight on the trends around cannabis use.
Great. Thank you so much. That was awesome. I learned a lot. I thought I knew this topic pretty well, and you informed me around a lot of things I didn't know or hadn't even thought about. So I really appreciate that. Also hearing a lot of other feedback in terms of a great job. So thank you so much for your time.
Thank you for having us, and feel free to reach out, and we're happy to continue working with you and provide you with some of those free resources that we have listed here.
Will do. Yeah. So take care.
You too. Bye-bye.
Bye, everyone.